Hello, this is Dr. Eric Bricker here again at the Frontier Direct Care Clinic, and I want to tell you a story. And it's the story of an employee at one of Frontier's customers who was about in his late 50s, early 60s, and unfortunately, his wife was very ill, and he took care of her for multiple years, and she actually ended up passing away, unfortunately. As you can imagine, he was devastated. Now, when his wife was still living and sick, he's a long-time smoker. He had been having a cough. He went and he got a chest x-ray, and they found a little spot, and they recommended that he have follow-up on that. Now, he was so involved with taking care of his wife, completely ignored it, didn't take care of it at all. Then, after his wife passed away, he had been having problems with his feet. So he came into the Frontier Direct Care Clinic and was talking about his feet. Now, of course, the primary care physicians at Frontier Direct Care, you always talk about a person's overall health. And so we were talking about his smoking, and he brought up the fact that he had this spot on this x-ray that he had never looked into. So Frontier had him go get a CT scan, and sure enough, he had what appeared to be a small mass in his lungs. Now, we can't say for sure that that's lung cancer, but there's a high probability that it is, given his he guy still smokes, given his long history of smoking. Now, fortunately, on the CT scan, it was actually remarkably still very small. So he immediately was referred to a pulmonologist for further workup, because the first thing you got to do is you got to take a biopsy to determine if this really is cancer or not. But look at that. I mean, this gentleman, oh, by the way, understandably so, like he was still grieving his wife and he was feeling depressed. And so to be able to have Frontier address his foot and his depression and his potential lung cancer, all of which would not have been possible had his employer not provided direct primary care to the employees at zero out-of-pocket cost for them. So just know that there are people who, they're in a tight spot. And it's not just Frontier, it's any direct primary care group, it's any primary care physician. There's so many folks that are working hard to try to improve these people's lives. And it's truly amazing to hear about these stories. And so I wanted to share it with you. Thank you so much. Bye.